Hi, it's Didrik Elman here, and this is Bella, an 8.5-year-old lovely border collie, a little bit paranoid. She doesn't like being here, but she came in the other day for a routine vaccination. As part of a routine vaccination, I perform a comprehensive physical examination, nose to tail, every part of the body examined thoroughly. And one of the things I noticed about her was that she has very stiff wrists. So I should be able to get both wrists and take this part and touch it through to here. But as you can see, that's as much movement as she's got in her wrist. I should be able to get that all the way to here. And the same with the left one. That's as much movement as we have in this wrist. So that's not very good. So we asked permission to x-ray her, and that's what she's here for today. We've already taken the x-rays, but before we go into the x-rays and have a look at them, they're really interesting. There's a lot of changes on them. She came in for a routine physical examination and vaccination, and her owner, who loves her dearly and is a very intelligent, caring and observant person, hadn't noticed that there was anything wrong. And the reason we found this problem is because I performed a comprehensive physical examination. You'd imagine that she would be limping badly with wrists as stiff as this, but she can't because she's got two stiff wrists. She's got two really badly damaged wrists. So she hasn't got a good leg to limp on, if that sort of makes sense. The other thing is that dogs are very, very, very good at pretending to be well. Out in the wild a million years ago, it's okay. Out in the wild a million years ago, if you showed any signs of weakness or illness, you were very quickly on someone else's radar as their lunch. So Bella has pretended, even though her wrists are really sore and stiff and she can't walk very well, she's pretended to be really healthy and really well, and even her caring owner could not pick this. So I'm just going to put Bella down for a sec. We'll pause the video and then we'll go and have a look at these x-rays together. Alrighty, welcome back. So when we take an x-ray of any part of a patient, it's really important to get a three-dimensional image. And so we always take two views, a side-on view and a front-to-back view. So we have 4 x-rays here of Bella's wrists, and as you can see, they're labelled right and right and left and left. And let's just start off with the right, and I'll show you what's going on. So first of all, there's a big bone spur. So this part of the wrist is the inside, so that's here, and that side is here. That's what you're looking at. But there's a big bone spur developing there. There's another bone spur developing there. There's another bone spur developing there. But from that view, it doesn't look too bad. A few bone spurs, there's a couple of little spurs here. You might think, okay, 8.5 years of age, not too bad. But let's have a look at the other view, which is the side-on view. So we're now looking through this way. This is the front, and then this is the back. Well, huge spurs sitting off the back of that, what's called the accessory carpal bone. And see the spurs here, right along the front of the wrist. All spurs, spurs, spurs. Just imagine those digging into your wrist. Now let's have a look at the left x-ray. And again, this is the front to back. And what obviously stands out is all these spurs down on the inside here. There's a very large area of damage there. There's a little spur there, a couple of other spurs here. And then let's have a look at the side-on view. Massive spurs on the front of that wrist, so that's here. Another big spur on the accessory carpal bone, just like the other leg. And then have a look at this whopping great big spur on the front there. And there's a lot of other minor changes as well, but they're the easiest ones to see. So Bella has severe degenerative arthritis of both those wrists. We can tell that clinically, and now we have the x-rays to prove it. She's in a tremendous amount of discomfort. Just walking is causing her discomfort. But there's a lot of things that we can do about this. She's a little bit chubby, we can get some weight off her. We'll put her on fish oil. We'll put her on glucosamine and chondroitin. She'll go on some turmeric as well. And then there's a drug called Synovan, which is an injection a week for 4 weeks. So all those things together will cause an immense improvement to her joints. Now this is a progressive disease. Every time she walks, this is going to get worse. And there's nothing we can do about it. Well, we are doing a lot of things about it, but in spite of everything we do, it will be progressive. So one of the things we can also do is curtail her silly exercise. So no ball chasing, no running, no jumping, lots of long walks, they're fine. And then we'll see how all that goes, and we may or may not throw in some extra pain relief, and we use meloxicam, which is a little bit like a Voltaren for dogs, if you want to put it that way. Please don't use Voltaren in dogs, it's really dangerous. I'm just trying to give you an example. So we'll use an anti-inflammatory like meloxicam, and we may even use a drug like Trammel. So we can make her life for the next, let's assume she's going to be around another 6 or 7 years, we can make it much, much, much more comfortable. So I guess my main point is, or my two main points are, dogs are great at hiding and pretending. So even dedicated pet owners can miss things on their pets because dogs and cats more than dogs even, are so good at hiding things. So it's really, really important to come and visit us on a regular basis, once a year, and that's about 7 years in dog and cat years, to have a comprehensive physical examination, check your pet out from top to toe, so that things that are hidden, things that are covert, like Bella's wrists, can be found and then something done about them. Hope that was interesting. See you on the next video.